Hi, this is Dr. Brian Jensen, and I just wanted to chat a little bit about some of the things that we see in practice very commonly. A couple of clues to key in on when you're starting to evaluate your patients. It doesn't matter if you use a scanning device like the one I use in my office, or if you're still using the foam casting kits that have been around for over 65 years, and they work great. I used them for a long time. But there are certain parts of the evaluation that we really have to pay attention to, and the scanner gets a lot of that information for us. But I want you to be aware of some of the visual signs of patients that might be candidates for getting orthotics. And one of the first things I notice when a patient walks in is I watch how they walk. I watch their gait. And what we typically see is that one foot might turn out a little bit more than the other one. That's an indication that we've got an imbalance in the feet somehow. One foot pronating more than the other one. It's a very common pattern that we see, but the feet usually aren't painful at all. So watch for that pattern of foot flare, and that's a really good clue that they've got a foot imbalance that's probably leading to some of the other problems that they have. If you see that imbalance in their feet, that foot flare, you're also probably going to see a difference in how their shoes wear, an uneven shoe wear pattern. The posterior lateral aspect of the heel is the part of the shoe that always hits the ground first. But what you're going to see is that one side wears out faster than the other one. And that's a problem long term. That means that the knee is being affected, the hip is being affected. And as a chiropractor, we always see that pelvic torsion pattern going on in our patients. And if you look at their feet, you're going to see an imbalance in the feet as well. So those are two real quick clues to take a look at. There's a couple of others I want you to be aware of though as well. If you'll look at their knees, and sometimes it's easier to have a patient in shorts to look at them, but look to see if one knee rotates medial more than the other one. That's also an indicator that that foot is probably pronating more than the other one. And again, the knee generally doesn't hurt unless we begin to overuse it, or we're active in athletics, or we have some kind of a very rigorous activity that kind of flares things up again. But that foot flare, an uneven wear pattern in the shoe, and the internal knee rotation, those are all clues that the feet are definitely involved and we need to look at them. If you stand behind your patient and look down at their heels and you look at the Achilles tendon, in a lot of cases you'll see that the Achilles tendons bow outward. And that's also an indicator that we have an excessively pronated foot. Sometimes it's both, sometimes it's just one. But a bowed Achilles tendon is an indicator of an excessively pronated foot. Ideally, they should be vertical in their orientation. So that's just another little visual clue that you can look for. If you don't have a scanning device, there's a really easy way to determine if one arch is flatter than the other one. And if you'll get down on the floor, patient standing there barefooted, no socks, take your hand and just simply slide it underneath the medial arch, and then just kind of measure how far your finger goes underneath that arch, and then compare the other side. And what you'll often find is that one finger will slide under the arch a little bit further than the other one. And again, that's a clue that you've got one foot that's flattening out more than the other one. Regardless of how you evaluate your patients, remember that there's 5 visual clues to keep in mind. The excessive foot flare on one side more than the other, an uneven wear pattern on the shoes, internal knee rotation more so on one side than the other, bowed Achilles tendons, and the low medial arch that you can test just by sliding your finger underneath their arch.